This educational video demonstrates a NICU music therapy protocol called multimodal neurologic enhancement. Due to a premature infant's immature neurologic system, they are unable to process sensory input such as touch, sound, and movement like a typically developing term infant would. Thus, they can become easily overstimulated by seemingly simple input such as smells, unexpected touch, or even standard nursing care, especially during experiences with many modes of stimuli such as a bath or a transition in or out of the isolette. This is problematic for the infant as overstimulation is accompanied by an increase in stress hormones in the brain, which inhibits optimal neurodevelopment. Premature infants who are constantly stressed have difficulty transitioning to sleep and maintaining sleep. They are often restless and waste many calories moving in their isolette, which compromises weight gain. Stress responses can often go unnoticed to the inexperienced NICU staff member or parent. The subtle but important stress signs to watch for include splayed or tense fingers, halt hands, grimacing, squirming or arched back, sneezing, frequent yawning, wide or averted eyes, flared nostrils, tachypnea, or other physiological instability. NICU music therapy protocols have been demonstrated to improve a preterm infant's tolerance of stimuli, but NICU staff and parents should be aware that some music can cause harm, and any time music is used in the NICU, it should be supported by developmental research. Certain music, especially that which includes multiple instruments, variable volumes and tempos, or unpredictable or irregular rhythms, should be avoided. For example, instruments like an ocean drum, which are sometimes used in the NICU to mimic womb sounds, are not supported by the developmental literature because the sound is not organized harmonically, does not contain a predictable and steady rhythm, and includes no important language information. The intervention you see here is called multimodal neurologic enhancement, which is a research-based NICU music therapy protocol used to improve sensory integration. Multiple studies have demonstrated the positive effects of this intervention, including improved weight gain and a shorter hospital stay by up to 2 weeks for boys and 3 weeks for girls. The protocol follows a 22-step progression that systematically introduces gentle lullaby humming or singing, followed by infant stroking based on cephalocaudal and proximodistal development, then vestibular input via rocking. This 15 to 20 minute progression is infant-driven, and stimuli are paused if the infant exhibits one of the aforementioned stress responses. Once the infant then returns to a calm state, the intervention continues. Multimodal neurologic enhancement should only be provided by a board-certified and NICU-trained music therapist. It requires an official physician's order and thereafter daily approval by the attending nurse.